Welcome to Impact by DIFFA Dallas, the official podcast of the Dallas chapter of the Design Industries Foundation Fighting AIDS. We'll share valuable info about the fight against HIV and AIDS, what our organization is doing to assist those in our community, and most importantly, how you can help us make a real impact.
Hello, welcome to DIFFA Impact. My name is Ronak Assadi, and I'm joined today by two very special guests from our AIDS service organizations, Andy Rohrbacher from AIN and Jennifer Longfellow from Legal Hospice of Texas. Hello, thank you for joining us today.
Hi, thank you for having us today.
So I'd like to begin just learning a little bit about your organizations. Jennifer, can we start with you?
Sure. So I am with Legal Hospice of Texas. We've been around since 1989. Since then, we've serviced about a little bit more than 16,000 clients, and our legal services, what we provide to the community is legal services for individuals who are living with a terminal illness or HIV and AIDS. So all of our clients come to us at a time where they have needs, and a lot of those needs are going to be legal. So we cover anything from Social Security benefits to Medicaid to Medicare, trying to maneuver what that means for our clients. A lot of clients will come to us trying to understand, what does this mean for my employment or for my housing? Do I need an ADA accommodation, for instance? So we even cover different things for our clients, such as the end-of-life documents, estate planning. So again, there's many things that we provide for our clients, and that's has been our mission since 1989.
Wonderful. Thank you.
Hi, so AIN, for the last 3 decades, we have been serving people with HIV and AIDS and other vulnerable populations. We are working to see a world without HIV, and we accomplish that mission through providing wraparound support services, helping people access the healthcare system, and helping them manage that system. We help them recognize that treatment is prevention, and we help arm people with the knowledge they need to have positive outcomes.
It's very interesting. You recently went through a bit of a rebranding, is that correct?
That is correct. So we started in 1986 at St. Thomas the Episcopal Church as AIDS Interfaith Network. A man entered the church and asked if St. Thomas would bury him. And at that time, no other church would offer him a service. And so the leaders of St. Thomas rallied the faith community around. And so until just recently, we kept the AIDS Interfaith Network name as we grew. But as the name, we started thinking about a rebranding as we started thinking about the possibility of a world without HIV. And we realized that in order that there would still be need after HIV, and so for the sustainability of the agency, and also for the changing nature of our services. We went through a rebranding, and we focus now on giving people access and information, and those names also fit AIN, and so that's how we rebranded.
That's wonderful. I love that forward-thinking approach, a future without HIV/AIDS, and it feels like we're on the cusp of it. 30 years ago, HIV/AIDS was a death sentence. And now look how far we've come. And I love that you guys are really changing to the times and you're adapting and you're still out there serving this very vulnerable population. And like you said, education, that is so key to give people the power to be autonomous in their health, to make their own healthcare decisions. It's so important. So we thank you so much for doing that work. Jennifer, I'd like to chat with you a little bit about the legal side of things. So I recall hearing a story once when I was at Legal Hospice of Texas about one of the clients you were serving was kicked out of their rental, or another gentleman who was fired after it was disclosed that he was HIV positive. Can you share about, a situation like that and
Sure.
how you guys respond to it?
Many of our clients, when they do come to us and at that stage in their life, it can be very overwhelming. Either they got a diagnosis of HIV or AIDS, or at this point, they know that they have a terminal illness at the end stages. Mm-hmm. And so what we want to do is kind of take some of that burden off. One example was an individual came to us, former military, was in his late 20s, and was rapidly deteriorating. And nobody could really understand in the medical field what his diagnosis was just yet. Well, he couldn't work anymore. He had to move back with his parents, and he was barely able to walk. So when he came to us, a lot of it was, okay, let's deal with getting your estate planning in place, getting your will in order, and let's apply for disability. It can be a daunting process. A lot of times you have to go down to the Social Security office and wait for 6 to 8 hours. The questions that they ask you can be very personal. And a lot of times it's so much information and so many questions, they're not quite sure how to navigate that. So he had been denied, even though it was clearly, you could see that he was rapidly deteriorating. Through the process of working with him within a couple of weeks and really talking and calling Social Security on a daily basis to make sure that they understood the severity of the situation, we were able to get him approved. And then working with one of our partners as well, another organization, we work with many throughout to try and provide other services and say, you know what, let's see if there's somewhere, another agency that might be able to provide you with housing. And one of our partners kind of wrote up an email and said, we're looking for individuals that fit these parameters, and we have some housing that we might be able to offer. So for him, it was life-changing. It was difficult for him to move back at home. He had been such an independent, athletic person. He wasn't understanding why he was being denied because, again, the questions and the process can be daunting and overwhelming when you have so many other things going on with your health. That becomes your immediate needs, not necessarily all the legal stuff involved. Right. We got him approved. Just a very young individual, and he's actually doing quite better now that he is getting his medical attention that he needs and going to physical therapy. And that's just an example of how we can really help clients immediately and get them what they need so that they can start to live by their how they would like to live and create an atmosphere so that they feel like, people are helping them and they have the support that they need.
That's wonderful. I love hearing success stories like that. And I love how you touched on the connectivity between other nonprofit organizations. I really love that DIFFA kind of brings all these different organizations together. Andy, can you share with us how DIFFA aids you in achieving your mission?
Yeah, sure. So DIFFA is a big help to us. Not only in terms of funding, but DIFFA gives us a way to promote our cause. A lot of people don't understand that, right? In the 80s and the 90s, everybody was, it was at an epidemic level. And then as treatment became more available and better, right? HIV kind of took a back burner, I would say. Now we've seen a resurgence in HIV, in new infection, because people aren't paying attention. And the DFW area is one of the top four cities in the country for new HIV and STD diagnoses and infection.
Wow.
So DIFFA gives us a place to help raise that awareness, right? That we're not done. Mm-hmm. We're not done, and we need to remain vigilant, and we need to keep up education, outreach. And a lot of our funding comes from government sources, and government sources are really great for programs like food assistance and transportation are two of our big programs. They're not really great about funding education and outreach. Mm-hmm. And so, right, DIFFA gives us the capacity to really fund education and outreach. Each year we reach about 14,000 at-risk men, women, and youth.
Wow.
Through a variety of health fairs and other events. So it's quite a big impact in the community.
Absolutely. I wasn't aware that DFW was in the top 4 for highest incidence rates. Why do you think that is? Why do you think HIV is increasing in general?
Well, so there's a number of reasons. One is I think we have reduced the amount of health information that is available to the general public. I think there are a lot of other things that are competing for other people's attention and resources. I also think that particularly there's been a change in attitude where people think, I don't need to worry about it. Right? I can just take a pill. And that changes people's behavior.
Mm-hmm.
The other thing is we're seeing a shift in the face of HIV. So the new face of HIV is primarily a single African-American female. And that community is traditionally underserved in sort of all areas of society. And so it just, it's a kind of a perfect storm of social and economic conditions that have what allowed what we call a second epidemic.
A second epidemic. It's funny, it's unfortunate that the perception of HIV/AIDS is that it's something that only affects the LGBTQ community, but that's not the case, as you said. And I think that's why it's more important now than ever to really continue the fight and raise awareness. And thanks to groups like you guys, we're able to do that.
Well, and one of the things that DIFFA has helped us to do is given us access to resources where we can develop evidence-based programs to target specific communities. So we have a program specifically designed to impact the African American community. We have a big Hispanic outreach initiative called Manos Unidas, United Hands. So these are the things where we're really targeting these newly affected populations that really have the greatest need for education and testing, right? And then if there is a diagnosis, right, they need access to service. Mm-hmm. And they need that in a non-judgmental, non-stigmatizing way.
Right.
I agree. A lot of it is with our clients. It's just education. What are your basic rights? What can you say if someone asks you a question, or what, do I need to disclose my status, those sorts of things. So educating people and giving them the confidence that they need in order to interact, whether it be in the work and atmosphere or sometimes in their medical atmosphere. So for us, DIFFA really does allow us to provide services to clients that might fall a little bit above what our income requirements allow. So it gives us kind of some wiggle room to be able to continue to provide services for individuals that are right on the cusp of not meeting the poverty guidelines. However, we still want to provide them with a service, and it might be something that it's going to make or break or really make an impact in their life, especially when it comes to maybe housing. We have individuals sometimes who they're on a set income, they're receiving their benefits or they're receiving their retirement. However, it doesn't always come on the 1st of the month. It might come on the 15th of the month. And so not only are they racking up now some housing fees or some late fees from their apartment or whatnot, but they're at risk of being evicted. And so we can assist them in creating an ADA accommodation so that we can get those late fees waived and they can continue to be in housing, because obviously we know that's going to create environment for them so that they can maintain their health and continue to take their medications and visit with their doctors.
Right, because how can you maintain your health, like you said, when you're facing eviction or when you've just lost your job? It's kind of a multidisciplinary approach, and it's very important that we, like you said, kind of tailor the education programs. It's not a one-size-fits-all approach. It's not just, here is an AIDS education program. It's different for that single African-American woman versus the young gay man. It's a completely different approach.
They kind of run in different circles, don't they?
Yeah. But I mean, it's how we all consume education, right? It's going to be different for everybody. So what do you think, Andy, is one of the biggest barriers that this community faces?
I think homelessness and income inequality are two very big challenges on the particularly for our community in Dallas. And the reason I say that is, we have a very large homeless population, and we have a very weak system to support them. And when you are on the street and you are trying to meet much more basic needs like food and shelter, you put yourself in a position for at-risk behavior. And so that's challenging, right? We've got to reach these people. We've got to satisfy very basic needs so that then we can reduce at-risk behaviors. Income inequality, I think, is also an issue where as a result of income inequality, people have just less access to resources. So we have a large population that doesn't have access to good education, right, and other services to support them, particularly after they've been diagnosed. And so that's a challenge also, as to how do we keep those people in treatment.
Right, and it's already so overwhelming to be diagnosed.
Absolutely it is, right? It's absolutely, and that's why we talk about at AIN, we talk about serving those in need and recognizing that treatment is prevention, right? So if I can give you, right, I can solve food insecurity for you. I can make sure that you get a nutritious breakfast and lunch every day that's designed to meet the dietary requirements for you to get the best benefit from your medication. Right? And I can give you transportation to and from your doctor and social services appointments and get you to the pharmacy. Right? That lays a foundation of prevention. Right? Because now those problems are solved. Right? Those problems are solved, and I can focus on higher level prevention behaviors. I can reduce my at-risk behavior.
Jennifer, I'd like to ask you the same question. What do you think is the biggest barrier that this community faces?
I do agree. I remarkably, when I moved to Dallas and began this work, I had a number of clients who were homeless, and it was a barrier to getting them the proper medical treatment that they needed. And also to get them to even, they didn't have reliable transportation either. And so to get them to come and see me just so that we can talk about the services that we might be able to provide for them, or applying for disability if that was something that they wanted to do, it was hard for them to even make those appointments. And so I agree. I think homelessness, I see a lot of that. And I do agree that I have seen kind of a changing demographic as well. And it's a much more diverse community than I think many people want to think of when they think of HIV and AIDS. And the income barrier. Lots of individuals are either homeless or they're relying on family to help them through this process, and it can be very stressful. So it really does affect not just them, but the community and their family, because it puts a lot of stress when they're not able to get the access that they need or understand the process of what it takes to create those wraparound services. A lot of individuals, especially if they're newly diagnosed, they come in and they know that they need our help, but they're not even aware that there's other organizations that can assist with housing or with mental health, those sorts of things.
And just to, really give you an idea what sort of the change in the demographics are. Right? So 62% of our clients are African American. 40% of our clients are women. A full 30% are Hispanic. And so that demographic doesn't fit, right, the typical stereotypical idea. And the other thing is, those are communities where, right, HIV and AIDS are highly stigmatized by those communities, right? And so those people are fearful. They're very fearful. They don't want to tell their friends. They don't want to tell their family. They don't want to seek testing.
Right. They don't even want to know their status.
Right. And so, everything that we can do to reach those populations, right, and let them know, hey, look, right, it's okay, right? You need to know, right?
And we're here to help you.
Right. And they're not only AIN, but right, there's a whole slew, right? There's a whole support network here that you can rely on to get through this.
So I'd like to ask you guys, how can people get involved with your organizations? Do you accept volunteers? How can people help out?
Well, we do accept volunteers, legalhospice.org, and there's an application process, of course, and there's various things that we need help with throughout the year. And we also have about 120 or 130 so volunteer attorneys. And that's something that we are always looking for, volunteer attorneys who want to help with estate planning or possibly take a case pro bono when it's something that we don't have the ability in our office because we don't have a full staff and paralegals. They might want to sue someone, or they might be a bigger case, an employment case with the EEOC. So we do have some attorneys that we turn to, and we have for the last couple of decades, that have been really helpful. But it would be great if people wanted to learn more about the organization and be willing to take a case, or just be willing to volunteer and learn more about what we do and how we service our clients.
Wonderful. And one more time, what was the website?
legalhospice.org.
Thank you.
So we'll take volunteers any time to help out, especially like volunteers to come help out in our DARE Center, which is our day center for our clients. We do a number of programs there, arts and crafts, yoga, right, besides serving meals and all that. But we have two good programs that I'm very excited about. One is called One Meal Matters, and we take groups of 6 or more volunteers, and they serve a meal to our clients. And do an engagement activity with them. Bingo is super popular. Everybody loves bingo. But it's a chance to really
connect with people.
Right, interact and connect with the clients. There's a lot to be said for sharing a meal.
Absolutely.
With folks. It's a great program to bring kids in on for groups. So young people and young adults particularly. We have a group from a college in Iowa that comes every year to do One Meal Matters. They travel all the way to do that program, so it's a great program. The other program we just kicked off this year, it's called One Moment Matters. And it's a full day of service at AIN. We start in the morning. It's for larger groups of 12 or more volunteers. We kick off the morning with a little AIN 101 and HIV 101. We split the folks up into different activity tracks. They go through every part of our agency. And they work in our coat drive, they work in the DARE Center, they get involved in the kitchen. And then in the afternoon, our case managers and social workers do some programming for the volunteers, talking about current topics in HIV and industry. And then we do an open Q&A with Stephen Pace, our CEO, and then we wrap up with some cake and ice cream, and so it's a full day. It's a really great program, particularly for companies, right, that are looking for a day of service for their employee recognition programs and retention programs. So it's a great program. If you're interested in either one of those programs, you can find us at AINDallas.org. We'd be happy to tell you more about how to get involved with it.
Well, I want to thank you both so much for being here today, and more importantly, thank you for this impactful work that you're doing for our community. You guys are the real heroes. Thank you from the bottom of our hearts. And to learn more about AIN or Legal Hospice of Texas, please visit difffadallas.org.